Okay, so good afternoon, everyone. My name is Mike Pepe, and I am the Director of Sales Engineering here at Synzi, and appreciate everyone's time this afternoon. So, as you probably signed up for this webinar, you noticed that we will be walking through our complete messaging tool, and that runs from everything from configuration to sending messages, and then even the reporting as well too. So, we'll be able to get through the bulk of the material today. I think in about 30 to 45 minutes. So it shouldn't be taking up the full hour for you all. So today, what we're going to cover, and I always like to level set, get everyone on the same page with terminology. This makes it easier when you're speaking to your account management team or support team here at Synzi. But some of you folks might be familiar with some of our messaging capabilities, but we'll just start at the basics and then work our way up. But we'll start off with configuring some of these templates and programs and mass blasts in the enterprise admin portal. And then we'll go over to the virtual care app where I will walk you through how staff are utilizing the messages that you create as well too. And then we'll take a look at two reports like I mentioned. Okay, so let's just start at the basics of the terminology, and we're going to be touching on each of these as we go through the enterprise admin and how to use them. First, we'll be starting off with templates. And templates are really the basics and the fundamentals of what you need to create programs and your on-demand messages, as well as for mass blasts. But templates are created with the content delivered via email, text, or in-app messaging, and you can customize these templates to differentiate between those different communication modalities. Templates can then be used as a standalone option for an on-demand message, so just a one-time message to a patient that could be delivered via text or email or in-app as well too. But then you can also, and we'll do this and we'll walk through this in Enterprise Admin, you can assemble a group of templates together to become an automated program. And some of you might be using programs currently, and we'll talk about condition-specific programs or with some of our clients across the country are using them for COVID-19, as well as some disaster preparedness. A newer feature of ours is a mass blast option. So this recently just came out in the past couple months. So hopefully, you folks have seen it already, but if not, I'll walk you through how to use this tool. Instead of sending an individual message to an individual patient, you have the ability to pick a template and then bulk send that out to a group of staff members or caregivers, and then to your entire patient population. And lastly, secure messaging. This we won't be focusing on too much today, but think of this as your HIPAA compliant instant message chat that's built within Synzi. It falls within the same family of messaging, but there are no pre-saved templates for that. So like I mentioned, think of it as your chat. We'll touch on it briefly just because it does fall within messages. Okay, so let's just talk about templates. This is really what we were just mentioning before, that you could have a standalone on-demand message or programs. This is my template area in Enterprise Admin. This is where we'll be starting in just a minute once we get into the actual platform. But the ability to create your own content library. We actually here at Synzi do have a content library of templates as well as programs that we'll touch on to choose from. So, if you are looking to focus on specific conditions, whether that's CHF, COPD, diabetes, any of the major conditions, please reach out to your account management team. So you can choose from the content that we have, or you have the ability to upload your own content. So we'll walk through creating a template in English. You also have the ability to create a template with the English version in another language. So if you're looking to create any Spanish focused templates, whether it's a annual flu reminder or hurricane warning, or managing any chronic conditions, you can do that directly. All right, so programs, we'll go ahead and we'll create our own COVID-19 program out of the 3 templates that we do create when we get into Enterprise Admin. But again, think of this as a way to schedule messages, schedule templates that are already created. Once we do create a program, we'll go over to the virtual care app. I'll show you for the clinician, how easy it is for them to go ahead and enroll a patient in a program. A lot of our clients across the country too are using our patient program management tool as a sales and marketing enhancement as well too. So not only with your own protocols built in, so not just think about how you manage your own chronic patients, but maybe how a physician, someone that you're trying to win business from, being able to customize a specific program. Let's just say, for instance, Dr. Smith's diabetes program, right? So it gives that physician, that group of physicians that you're working with, as a home healthcare agency, a leg up on the competition. And if you have any more questions about that, please reach out to your account manager. We're more than happy to help with any sales and marketing presentations, especially on the patient program management side. But like I mentioned, a lot of our clients across the country are using this portion of the platform as a sales and marketing tool to win more business. Okay, and here's one of our newer features, the Mass Blast option. So we'll go through this as well too. Here's just a sample hurricane season reminder. Like I mentioned, you have the ability to bulk send this out to maybe your whole patient population, or I'll walk you through how choosing different staff or caregivers. And this can be just a quick method to send out a message across your whole organization if you needed to. Think of inclement weather, think of COVID-19, think of anything that you just want to send out via blast, email, or text message. All right, so let's go ahead and go into Enterprise Admin. So depending upon your permission levels is really going to dictate what you're seeing within Enterprise Admin and what you're seeing within the clinical content area. So I'm actually over here on my left-hand side under Patient Communications and Templates. If you have never built a template, or there are no templates uploaded by your implementation team or your account management team, this area is going to be blank. Okay, so these are templates that I have already created for my own enterprise within here. All right, but let's go ahead and just take a walk through so I can orient you from the screen, and then we can go ahead and create our own template directly within here. But I'll go ahead, I'll pull up my annual flu shot. To view any of the content that's within a template, you can go ahead and just click on the language directly here. And this is my English version of my annual flu reminder. Okay, so this is where you get to create what content that you want to be delivered via which modality. So if you want to have a more concise message for your text message field versus your email or in-app, you can absolutely do that. There is a character limit, and we can talk about that at the end as well too, for the text message, and it's just delivery. It's more on the carrier restrictions. Okay, you also have the ability to create a template, like I mentioned, in another language. So if you did want to view the Spanish version that you did create, I could just click on the language again as well too, and I can view that. So let me orient you first to the screen, and then we'll go ahead and create our own template. If you ever need to disable a template that you just previously created, you'll notice this little lock button, and you can see this across the user list or patient list. What this does is disables the template. It'll never physically delete it. It'll always appear at the bottom over here in gray. You might see these little abbreviations, a P or an O. Okay, so P is for a template that's going to be designated for a program, and then the O is for an on-demand message that's just going to be a standalone message. You can have, like my annual flu shot right here is actually going to be used for both. All right, so let me go ahead. I'm going to create a new template that we're going to use as an on-demand message, and we're going to use it for our Mass Blast, but we're also going to use it for our program. So if I click on the blue plus sign, I have the ability to go ahead and name the template. So I'm just going to call it COVID-19 education. And if you ever forget the difference between programs or on demand, we list what they are directly underneath. So programs, again, can be scheduled to send automatically, and on demand are standalone templates. So we're going to use this for both. So I'm going to toggle both on. Okay, and so now I could either go search for my template, or I can find it right down here. So if you notice something different, I currently don't have an English version. I need a translation here. So I'm going to go ahead and add a new translation. We're going to add an English version here. And I already have a pre-saved text that I'm going to use. And I'm actually going to use the same content via email and via text as well too. Our best practice for an email subject is to list your organization name and what the message might be about. Think of your own personal email. Just a generic subject might not be catchy and you might not click on it, but we've done a lot of studies on patient engagement. Our platform is one of the best in the arena for engaging patients and engaging patients in one of the hardest populations, right? So these are some of the best practices that we came across. So if I just do a message, MP Medical Associates. Okay. Once I have all my content assembled, depending upon your permission rights, you might just have a save function, which will then just save the template. Someone will need to go in and publish that template. If you have full permission levels, you'll have a save and publish. So what the publish does, it makes it available and ready in the virtual care application for your staff to use. Okay, so once I create it, I now have my English version of my COVID-19 template right here. All right, let's go down to the program area. So let me take you through a walkthrough of just one of our programs that's already assembled, and then we're gonna go ahead and just create just a sample COVID-19 program so you can see what that looks like. Let me go ahead and pull up my CHF program. This is obviously a condition-specific program. You can have many different types of programs. So whether it's condition-specific or an administrative program, we have a lot of clients that use a welcome general engagement program. Maybe a patient is new to home health, might not be aware of or know anything about your organization, might not even know how home health works. So you can create a welcome program that includes a video link, maybe a website link within there, and over 30 days. But for instance, this one, the CHF program, over 30 days, they're going to receive 8 different messages. Okay, and those are going to be delivered via the patient's preference. And we'll go over that in the virtual care app via text or email. And here is the current schedule. So all these different CHF templates that I had built, and there are things like reminders to weigh yourself, reducing sodium intake, medication reminders. These are all assembled, and these messages are going to go out automatically depending upon the enrollment. And we'll go ahead and create a program so you can see the options for enrollment. You can also manage when the messages go out. So if you just prefer a weekday program, Monday through Friday, 9 a.m. to 6 p.m., you can create that. Let's go ahead and create our COVID-19 program. So I'm just going to call this COVID-19 and flu season, since I'm going to create 2 different messages within there. Okay, and I just want this actually to go out Monday through Friday. I can put a description in here if I want. So I can put 10-day program with 3 messages. This does not get displayed to any patients at all. This is more of just a management for you and your staff, that if you did want to get just a brief overview to see what's in the program, you can do that. Okay, so I have my program shell created. I have the ability, just like you saw in the templates, if I made a mistake or I want to get rid of it, I can disable it, but I can edit it directly through the pencil here, or I could just click right on the name. Okay, so we have a program now with no messages scheduled. So let's go ahead and we're going to add some of the templates that we just created right now. All right, first option is to choose the message that you want to go out. So I actually know I'm going to add my welcome message. Okay, so I already have a pre-saved built template as a welcome message. If you scroll down, you'll see the preview if you forget what's in that message. Okay. I actually have a video link in here. So I have a short video here if the patient wants to go ahead and watch a YouTube link on what home health is. Okay, now let's just talk about event types. So this is going to be a pure educational program, but you do have the ability, if you want, to include a virtual visit link or contact a care team within here. So think about some of your chronic conditions. Okay, so you can create a virtual visit link maybe on day 3 after a patient's discharged, they get home, a nurse goes and visits them at home. You can create a virtual visit link within there that if they have any questions, they can either reach out to a specific person, or it might just go to a pre-saved group that you already have. And this ties back to care teams in the Synzi Care Connect app. Okay, but we're just going to leave this as an information-only message. There's nothing for the patient to do. Within there, they don't need to click on anything. It's more of just an educational read message. Then you have 2 options for when you want this specific message to go out. You can choose a specific date and time, or you can choose after the patient's enrolled. And once we get over to the virtual care app, I will show you what triggers all these timings there. So this one's actually, we're going to configure it to go out 1 day after the patient's enrolled in the program. So if the patient's enrolled today at 1:15 Eastern, when I go to enroll that patient, they'll receive this first message at 1:15 Eastern tomorrow on Friday. So once I have this configured, I'm just going to hit save. And now I have my first message in the program. All right, let me go ahead and add my COVID-19 template that I just created. And I can either scroll down or I can search. Okay, and if I can't remember again what it said in the template, I can just scroll down and see this. And it's going to be an informational only message. And this one I want to go out on day 3. Okay, so we have one message going out 1 day after enrollment. This one's going to go out 3 days after enrollment. And now that we're getting into flu season as well too, in some parts of the country, getting there, I'm going to go ahead and include an annual flu season reminder. Okay, so just a quick brief reminder to go get your flu shot. And if you have any questions, call our office or send us a secure message. Again, you can customize whatever you want to be in that template. All right, and this one's going to go out on day 10. So I have my messages spaced out 1, 3, and 10. Again, you can space them out however you like. Our best practice is to not overwhelm with too many messages. A patient always has the ability on any program messages to unsubscribe or opt out, and you can absolutely run a report on all those folks that do unsubscribe. But some of our best practices from some of our clients, as well as some of the national programs from National Institute of Health or American Heart Association, has a very similar cadence. All right, so this is actually just going to be a 3-message program, and I'm just going to leave it at that. It's just going to be a quick COVID-19 education template and flu season program, and just obviously welcoming them to the organization. So I'm going to hit save, and we'll go back and we'll use this on the actual patient's profile once we get over to the virtual care app. All right, so let's scroll up here. This is one of our newer features that I mentioned. This is the mass blast option. So most of you folks are probably already familiar with how to send an individual message. We'll touch on that for any of our newer clients on the line right now. But this is one of the newer features where you have the ability to choose an on-demand template. Okay, so it was a template that wasn't designated as a program template. It was designated as an on-demand template. Choose a template. Go ahead and give it an email title, because some of your patients might just have an email on file. They might not have a cell phone on file. Okay, if you did have the template in another language, so if you did have it already translated into Spanish, you can choose that from your drop down right here. We only have this template loaded in English right now. It'll give you the content here, and then I have three options. So from here, let's just say I want to send out inclement weather, and I know in some parts of the country, maybe a hurricane too, or other parts of the country, we have winter coming up. So if the office might be closed, maybe you want to send a bulk message out to all your staff members. Or maybe you're a multi-location group and you might be in different states. And one of the states is affected by a natural disaster or a hurricane or just a snowstorm. You can choose a specific group that you already have set up, and these are the same groups that are set up under the staff users. So I can decide which teams, which groups I want to send this to. So this would actually go to my North Region team and my endocrinology team. You also have the ability to send it out to all patients, okay? And then this will be delivered via the patient's preference. We'll take a look at that in the virtual care application. Or you have the ability to send this to caregivers as well too. And these are any caregivers that are listed under the patient. All right, so let's go ahead and go into the virtual care app. This kind of wraps our portion in the enterprise admin on configuration. Okay, so all configuration for programs, for templates to send out a mass blast takes place within the enterprise administration. Okay, your staff, the rest of your organization, you're preparing this content material either on your own or working with us, so your staff has it live in their environment to use. Okay, so now I am logged in on the virtual care application. I'm actually logged in as Dean Klein, just a registered nurse. And let me just take you through some of the options that we just created in enterprise administration. So most of you are probably all familiar with the text email option. Okay, the envelope right here. This is your non-PHI channels, right? So because it gets delivered via text or email. So the staff user, the nurse, has the ability to free type here, or they can choose from an on-demand message that you just created. Okay, so a nurse might be working with a patient and maybe just wants to send them out an individual message. That's where the templates are created. They're standalone on-demand messages that they can choose from as well. All right, here's my standalone discharge instructions. I actually have this one translated in Spanish. So if I know my patient Ron Daly here is primarily a Spanish speaker, I can go ahead and choose from my already pre-translated Spanish template here. Okay, and those messages, whether it's programs or the on-demand messages, are delivered via the patient's preference in the communication preferences area. So if the patient's already created, you can edit them. If they do want to receive messages via email and text, you could select both here. Okay, and this is where you can change the language. All right, so I'm just going to cancel for now. Now, programs over here, here's some of the ones that we just created already. Okay, so here's the COVID-19 and flu season program. Once you create and save a program over in Enterprise Admin, it's going to be ready immediately and available for your staff to use. I then have two options. This is the point of enrollment right now. So if you remember when I created my COVID-19 program, it was 1 day after enrollment, 3 days, and 10 days. I can either choose now, which will log it in as 1:24 p.m. Eastern time on Thursday, and then everything will fall into that cadence, or I can choose a specific enrollment date. Okay, so if I do have a specific flu season program and I'm working with the patient in March, I might not want the program to go out 10 days from now. Maybe I want to assign it in October, right? So you can really control when you want these programs to begin or end. All right, but I'm just going to go enroll now. And now I have my program listed here. Me as the staff user, I don't need to worry about adding any additional content, changing anything that's already created by my administrator and enterprise admin. But me as a staff user, I do have the ability that if I want to see the messages that are going out, I can see what days they're going to be going out in. I have the ability to disenroll a patient in that program, but I can also delay a message. I can reschedule it. So for instance, this last message is the flu season reminder, right? So I can decide, August might be too early. Maybe I want this one to go out October 1st. And I could also mark it as complete if I needed to. But now I save it. They'll get their welcome message. They'll get their COVID-19 message, just a reminder to be washing their hands and wearing a mask. But then they also have the ability to change the flu shot reminder. Okay, so just a little bit more flexibility for staff members on that side. If I change the preferred language here to Spanish, so as you noticed, I did have some templates translated into Spanish. If I did have all three of these templates in my COVID-19 and flu season program translated into Spanish, I wouldn't need to manually change anything. So me as a staff user, if I have this language changed to Spanish, they will automatically go out in Spanish if they're already translated. Okay, so think about any other populations that you're serving, maybe in specific conditions, maybe CHF, COPD, and you want to target some of your Spanish speakers, some of your Cantonese speakers, having those templates and programs already translated, it's really just a set it for the staff user, and then they automatically go out. There's no thought or any process that needs to take place for your staff users. All right, they also have the ability, and I know we touched on this on the original slide, is the secure messaging, okay? There are no templates created for this. Think of this as your HIPAA compliant chat. And for those folks not familiar with it, you have the ability to turn it into a group chat as well too. And you can also create distribution staff groups. All right, so you saw the mass blast option that'll go out via email or text, but maybe you want to send a mass secure message to all your nurses or to all staff members. So these are messages that are going to go out to all your staff members directly through the application, not text or email. If you need text or email, you'll want to use that mass blast option. All right, so let's go ahead and go over to Enterprise Admin. And I want to show you all two reports that are really helpful on the messaging side and the program side. The first one, and I'll just pull up my reports section. So the first one I pulled up is the program compliance report. And again, this is all dependent upon your rights and your permission levels within Enterprise Admin, but you have the ability to choose a date range. So I chose a date range up here. I think I just chose it back in July. But you have the ability to choose a specific program. So I have data in my CHF program. That's why I have this one pulled up. But it'll give you every single patient that's enrolled in that specific program. Just like any reports in Synzi, you can download this to CSV if you want to further manipulate any of this data. But it'll pull it up by patient, okay? And so I can quickly see the summary up here, who's in compliance and who's out of compliance. So in compliance and out of compliance just means if there's any action items within the message, and if they need to respond to anything within the message. If it's just educational only, it'll capture the open rate. So let me just go ahead and I'll pull up Ron Daly over here, my patient. It'll give you his demographic information, and then all the messages that were a part of his CHF program. Okay, so we're just in this program specifically. You can go through and you can see the exact content that went out to him. He was actually disenrolled out of this program. But if I had left him long enough in one of these, and I did over here on day 20, you can actually see that he opened his email. Okay, so the other messages were just expired or pending, just because, like I mentioned, I disenrolled him. But if it was an open pending message, you would all have listed pending here. And then if he actually did open the email, it would change the response to open. If you wanted to view a patient specifically, okay, so now I'm in the patient activity report over here. This is going to give you every single message that left out of Synzi and what programs that specific patient was enrolled in. So you'll get a similar summary up top. You know how many messages were complete or incomplete. See the total amount of programs that he was enrolled in. So he's only enrolled in one active program right now. And then again, I can get a detailed activity report and pull up which messages went out, if they were pending, if they were opened, if it was sent out via text message, if it was sent out via email as well. Okay, and again, you can download this to CSV if you're trying to audit a specific patient record to see which messages came out directly. So you can either do it on a program level, like I showed, specific CHF program, here's all my patients that are in the specific program, or I can drill down into a specific patient. All right, so that concludes the end of our messaging. Let me go ahead and just pull up the Q&A to see if we have any questions. All right, so we actually have 2 questions that were sent in directly. What happens if you exceed the character limit in the text message, and why is it restricted? Okay, so some carriers, and this is not a Synzi restriction, but it's just more of a warning for and this is for the SMS messages within the templates. Some carriers like Sprint like to break up the messages. So, you know, typically Verizon, AT&T, I have not seen this with, but, you know, Sprint will go ahead and break up the specific messages. So you might, if you've ever seen a text message on a Sprint device saying 1 of 2, 2 of 2, we just give that character limit warning to eliminate, it's almost like an insurance policy, but it's to eliminate any error that could happen of a second message going out first before the first message. So, you know, if you're sending a coronavirus educational message, you do want to keep it to that character limit because you don't want the last part of the message to come first. Okay, and our second question is, where does our clinical content come from? And this is, I'm guessing this is for the specific programs, but like I mentioned earlier, we, you know, we've worked with a lot of our clients in the past on best practices. We've also sourced a lot of content from the National Institute of Health, American Heart Association, just to name a couple, some of their best practices, educational pieces. What a lot of our clients do is use our standard content if they don't have their own educational content to load. You have the ability, as you saw within the templates, to tweak it, make it your own, make any edits. Or if you just like how the content is, and remember, it's got to be generic to a point because it can't be too clinically focused because it is being delivered via email and text. You can go ahead and make those edits or just upload it how it is and go from there. But like I mentioned, if you have any interest of focusing on some chronic conditions to start, whether it's some of the major ones, like I mentioned, you know, please reach out to your account management team. They can share with you our clinical content. And if you do like it, you could go ahead and get it built into the platform and can be using it with your patients directly. So let me just make sure we don't have any other questions. Okay. Thank you for everyone's time today. That concludes the webinar. We went ahead and recorded it, so we'll go ahead and send it out to everyone. But if you do have any further questions on just getting started with templates, programs, or the Mass Blast feature, especially as we approach hurricane season and flu season and how our clients are using it for COVID-19 during this time, please reach out to your team at Synzi. Thank you all.